Welcome back to Threat Watch, the 15-minute podcast from Lumify Cyber, where Fred and I are going to dig into some news and try to make that make sense. Fred, conference season is coming back. What does your schedule look like? You got any travel coming up? Because I
Uh,
do.
oh yeah, tidal wave. Going to be doing the Midwest sweep. I've got Iowa speaking there, an Illinois Health Association or Hospital Association luncheon, and the Minnesota Annual Hospital Association out at a beautiful resort called Gull Lake. And I just got back last week from the Vermont. That was the retail management or receivables management association, which is all the debt collectors of the world that had some of the biggest breaches that we've actually
Yes,
talked about
yes,
on
they
this
have.
particular
Yes, they have.
podcast.
I
So I
bet they
got
were
to
interested
speak.
in what you had to say.
I got to speak directly to some of those people we've talked about here. So fascinating stuff. Yeah.
Yeah, well, I have Washington State Emergency Management, Idaho Hospital Association, Association of County and City Information Systems. Washington State has asked me to do one of their security awareness trainings in October, and I think I was just asked to present at a Seattle Sim on the use of AI in SOC operations. So, wow. All right, well, let's get going. What's going on? Scattered Spider is working on their own ransomware as a service model. Great. St. Paul, Minnesota has been all but shut down. Iran is targeting financial, government, and media organizations, but we're not going to talk about any of that. I want to talk about first a new issue for healthcare. I mean, it's probably not a new issue, but an internet scan was done by Modat. Okay, and that's an EU cyber company, and it turned up 1.2 million healthcare devices and systems that are leaking data online. 174,000 of those are in the U.S. What do you say about something like that?
There's so many things wrong with this. I'll
You
start.
think?
Yeah, I'll just start at a general level. We do a lot of things in this space, like we call them biomedical risk assessments. And one of the challenges that's being faced is those are normally not owned at all by the IT department. They're owned by the biomedical group, which are practitioners. They're well meaning. They certainly want their systems to stay online, but they, frankly, are not experts at securing any of these devices. And they tend to be at the whim of the medical device manufacturers who say, hey, we'll take care of those for you. We'll take care of those problems. So the first thing that comes out here is the 70 different types of medical devices. So this is everything: MRIs, X-rays, blood test systems, what they call DICOM viewers. That's all your medical imaging, right? I
Mm.
keep hoping that if they got anything, they got my last colonoscopy pictures because they can suffer through that, right? So hospital management systems, all these things, right, are connected together through this medical device infrastructure. It, in fact, has fingers that run into all sorts of things from the cloud, because they're sending data a lot of times to the cloud, or sometimes they're sending to internal systems. So these have a lot of reach. Even though they're relatively focused in what they do, the problem is these were exposed to the internet. That's problem number one. There are only one or two instances where they should be allowed to speak to anything on the internet, and it should be mapped at the firewall to a one-to-one connection that allows only you to speak to that singular IP address, which is maybe the cloud end of some kind of monitoring equipment, right? I went around a little while ago wearing a overnight heart monitor, right, that does communications in this fashion. So yes, some things do need to speak to the internet, but in general, the only other people they might ever need to talk to are their manufacturers, if that's how they do remote management or collect telemetry or updates or things like that. But otherwise, first thing we do when we go in and we tell people your medical devices need to be segmented on their own isolated network, and you should be controlling access at that network level right between it and your rest of your network to say you can only go this place. Your internet firewall says the same thing. You can only go this one place. You have multiple places to monitor then when things all of a sudden are trying to communicate to something they shouldn't. That's a great indicator of compromise, people. Why is it trying to talk to an IP address in South or North Korea, right? So these are things we need to think about here. The scanner was able to, I mean, that their data was the things they found were everything: brain scans, medical patients,
Yeah, they pulled data off. Yeah.
just about everything,
Just in their scan.
just in the scan, right? Just as a remote scan. And this thing is not unlike Shodan, right?
Yeah.
I would guess that Shodan can do the exact same set of things. So I'm miffed because this should be table stakes.
Well, I mean, to me, this is kind of reminiscent of the Iranian hack of the water utilities, where all they did was look up the default passwords for these Israeli-made programmable logic controllers, right? This is 1A stuff because we're talking about systems with without even basic authentication strength, right? There was a lot of default passwords. There was a lot of passwords like admin or 1234566, right? So, your biomedical folks maybe need a little primer. Maybe you might want to send them to security awareness training when I talk about that. Um, to me, I mean, this really goes to show you how healthcare, especially rural healthcare, just they cannot afford to attract and retain the kind of practitioners they need on staff to avoid things like this. Because you're right, it needs to be segmented. There's a strong access control at the network level. Now, on the upside, they did responsible disclosure and they told, the Health ISAC and they, spread that information around. So this is hopefully all getting fixed right now. But listen, healthcare, Microsoft and Lumify and a bunch of other companies are part of an AHA program to get you discounted rates on Defender, Sentinel, and a managed SOC service. And consultants can help you avoid being part of that 174,000 list. Okay. That's enough of a commercial, but call someone, please. Fred and I are 65 now, and we need you to be there.
Yeah.
All right, moving on. All right. Let's talk about the apparent last gasp of the state and local cybersecurity grant program. The final $100 million has been released. And while there have been lots of calls by some in Congress and associations of state and local government IT professionals to reauthorize the program, there's been no real action in that direction. To me, that's sad. And there is even an irony that I want to hit after I get some comments from you.
Yeah. So I think the irony in some sense to me was the day this news hit, it was celebrated. Oh, wow, the big 100 million. That's not to be celebrated. That's the end, the spigot being turned off, and that's a drop. That's one drop out of the spigot that we need. There are 90,000 local governments in the U.S., right? And so we're going to chop that up into $1,000 a piece, and they're going to go buy a week of security awareness training for 3 people. I mean, I don't really understand what that means. If you then distill it down to the people that absolutely need it, like rural healthcare, cities, small cities, local government. Now that the pool is still, it gets you one assessment maybe, right? And we do know that a lot of cities and counties deeply rely on this. They have built this into part of their kind of budgetary program. We work with them all the time, and are working with them to grab a piece of this very last $100 million as it sits right now. But the amazing thing is the executive order. You've heard me say this before. It's like now local cities are doing national defense, because when you're fighting the Chinese and the Russians and the Iranians, right?
Sure, Dubuque
right?
can do that. Sure,
it's not organized crime, with Godfather style. It's armies and as we just I think heard that both the Russians and the Chinese have been caught with their fingers in a lot of the cybercrime. The government has been supporting a lot of their programs as well. So now that Sean, I don't want to get the name right, Planky, right, is the head of the CISA.
Yeah.
He's giving signals that he may step up to the plate and go to bat for this. What do you think? Has that going to happen, Mike?
I mean, yeah, that's the wild card, right? There's new leadership at CISA, right? Now, setting aside the nasty thing that the administration did to Jen Easterly when they rescinded her appointment at West Point, I won't talk about that. I think Mr. Planky knows this is his lane and he wants to do the right thing inside the confines of a redirected CISA. Okay. So, I've read that some in Congress want CISA to focus on taking on more of the regulatory responsibilities that the sector risk management agencies were handling, right? Like EPA for water, and to administer a 10-year reauthorization of the grant. But that was just talk and there's no legislation yet. I think he's going to be an advocate for that, and I certainly hope so. But now I got to point out the irony. Okay, so the sector risk management agencies had to pull back on regulatory work because the EPA wanted water to submit cyber risk assessments, and 3 states sued because that was an unfunded mandate. State and local governments having to take on all of this with no funding is an unfunded mandate and makes no sense. Got to say that. Got to say that. They followed up an unfunded mandate with an even bigger one and said, okay, we're calling it good. All right. All right. I don't want to rail on them anymore. Let's go international. So poor Russia. Oh my God. Just in the last week, Ukraine hacked Aeroflot, their airline, right? Had to cancel like all the flights. And importantly, stole design details of Russia's newest and most lethal submarine. Okay. And I think it was a few weeks ago when you and I talked about Gazprom getting hacked, right? I haven't seen any follow up on that. Have you?
No, I have not.
No. Okay. But they completely bricked all the computers.
Yes.
So
Yep.
whatever definitions of cyber war anyone was throwing around, I think now we see infrastructure disruption and cyber clearly being used for military purposes, and the gloves are off. Russia's tactics are coming back on them with interest.
Yeah. I've been shocked that we haven't been called this cyber war for a long time. I mean, what are they expecting? Like some, the entire. I mean, yeah, it's possible the entire power grid could go down in the U.S. That certainly is.
Not
but
really.
Let's not call that. Let's not call that the only definition of cyber war. I mean, I think we're there, folks. And it's not just Russia, right? We know that the amazing stuff in the Israeli-Iran war. Some of that is utterly fascinating. The techniques were used there to understand where people are at using door cams and tracking people, and then killing them, based on
knowing where to shoot the missile. Yeah.
Right. All sorts of, some fascinating stuff. China, it sounds like they're even deeper. I think the blast was in the blast today, even deeper into Taiwan's infrastructure than maybe we all feared. And India and Pakistan are going at it. Thailand and Cambodia are going at it. They're starting to go to the cyber. A lot of these things start kinetic and then turn cyber. You think it might be the other way around, but as they cool down on the kinetic front, they kind of pick up sometimes on the cyber front because people don't really want to quit. Question is, how much of this is state? How much of it is it activists? Is it patriotic recruits, right? Because we kind of have these quasi, military units now that come from other places to support, particular causes. And then at the bottom of it, there's still, I'm sure, all the criming, that's underneath it. That always rides in the middle of any of this because, when things are vulnerable, it's a great time to take advantage of things. So once all the wars dies down, where all these bad guys go that have spent the last 5 years conducting cyber war around the global cyber war, where do they go? What happens to them?
They're going to go into crime, man. That's look, that's the attractiveness of crime right now cannot be overstated, and the ease of getting into it, the other thing was the Norwegian dam, right? And they just blame the Russians for that. You and I are in Washington State, and a lot of our power comes from falling water, right? So dams are at risk. And I know that the Department of Energy wants to get OT monitoring into dams and train the operators on that use, right? Because, nobody's monitoring what's going on in control rooms. I also know that the State Department wants to get countrywide cyber monitoring into Balkan countries, both for the purpose of all the telemetry that would give you, right? You can see broadly what's going on, the doorknob twisting going on that precedes something, but also for workforce development. And I know this because we're talking to them about deploying Pisces monitoring in a couple of the Balkan countries that I won't name. So, with all the bad stuff happening, at least there's some movement to provide more monitoring, especially of operational technologies, in an effort to minimize the impact of what is likely coming, right? You want to see the initial access and expel the threat before the disaster happens, right? So, there's, all the cybering is going on and it's cyber war, if you want to call it that, but I do see efforts to try and blunt the effects of that.
Yeah. Well, since that cyber war doesn't seem to be slowing down and you and I need to get back and man our positions.
Yeah.
What are you going to leave us with so the impending doom is not so more palatable somehow?
So I don't know. Some people are not going to think this is funny.
Okay.
But I like to take punches at all the AI mishaps. Okay, well, here's a flub that was, I think you will agree, was frankly predictable. And if you're the CEO of an AI company, you're having some indigestion right now. So the largest copyright class action ever has been certified by a court. A single lawsuit was raised by 3 authors over Anthropic AI's training, and that threatens to financially ruin the entire AI industry. Okay, so before before it ever got going, uh, you know, as their startup, they swiped a bunch of copyrighted data for training models, and the holders of those copyrights are punching back. So now there's probably going to be an appeal. We don't know how that's going to end up. But the entertainment and publishing industries are likely to add more plaintiffs, up to 7 million of them. And as a result, popcorn futures are going way up while we get ready to watch this. So sorry, AI, shouldn't have done that. Okay, if you haven't already, sign up for the InfoSec Insider Daily News Blast using the link on the Lumify site. Show up for security awareness training now on the last Thursday of the month, which is the 28th of this month. And watch us for upcoming events like Threat Lab Live. That'll be on the 27th of this month. Fred, see you later.
All right. See you next week.